Thank you all for being here. I want to thank Valley Baptist Medical Center for hosting this. Looks like a really pretty amazing lunch for today. All heart healthy with the right kind of amino acids and fats in it, which Mary will talk to you about in a bit. Well, anyway, again, thanks for being here. And what we have to talk about is appropriate for Valentine's Day. Hope you all had a good Valentine's Day yesterday, right? Good. So anyway, happy the day after Valentine's Day. But it's appropriate that we talk about the heart not only on Valentine's Day, the day after Valentine's Day in the month of February, but every day, because as you all know, heart disease is prevalent. All you have to do is look around the room or at yourself and look at somebody that's either had coronary disease or is going to have it, because in fact, coronary disease, myocardial infarction, is the most common way Americans die. Shouldn't have to be that way, but it is. The important note here is that this is probably the most preventable problem of modern society that there is, preventing coronary disease, because we know how to prevent it, we just need to do it. Now the big issue is what's the difference between men and women? Well, you'd think since the days of Adam and Eve that there's some obvious differences between men and women, but we really didn't know a whole lot about how men and women respond to treatment, nor did we know how men and women differ. If you look at the numbers, I don't have any fancy slides to show you, but hopefully you can use your mind's eye to kind of follow this along, and the numbers, we won't use too many numbers. But if you look at can you hear me?
Get you a little closer to the mic.
Okay. Can you hear me back there? Yeah. Okay. If you can't hear me, there's a piece of chocolate, I think, on your table. You can throw that at me. We'll talk about chocolate a little later. Well, anyway, so men and women are as likely to have heart attacks. It's just a matter of when. That men have their heart attacks sooner and women have them a little later. The big issue here is that men typically describe their heart attack in a very typical fashion. You've probably seen it on TV, you've seen other people talk about it, and it's called the Levine sign. You take the closed fist and it hurts right here. And going up some stairs. Some of you may remember the poster that was published in the Saturday Evening Post many years ago. It was this man walking up a set of stairs in a cold winter breeze, bundling up his coat, and he just got out of a restaurant. And he's carrying his suitcase, and he's dropping his briefcase, and he's dropping his briefcase. Well, that is about the best descriptor of angina that I've ever seen. And in fact, if you can remember this picture, he had all the findings of it and all the risk factors for having coronary disease. He just got done eating. He was exerting. He walked out into the cold, which is a stressor. A bit overweight, and he had a pack of cigarettes in his pocket. So in one picture, all the risk factors for having a heart attack. Of course, this was a man. He was probably in his 50s to 60s. So the same type of things happen to women, but women present to the hospital and to the doctors with different findings. Why are these findings? We really don't know why these findings are different in women than in men, but clearly they are different. The other statistic that's important that we have to change is that if a woman gets a heart attack, she's most likely to die from it than a man. And why is that? Well, I think we do have some reasons why that may be and stuff that we can possibly change. Well, women, for one, are typically smaller. A heart attack is a blockage in a blood vessel that supplies the heart. These blood vessels are small. They're 1 to 2 to 3 millimeters in diameter. Now, what is a heart attack? If you think about how a heart attack occurs, it is basically a blood clot inside of a tube. Now, if you cut yourself, you know you get bleeding, right? And that bleeding stops, which is good. It's nature's way, otherwise we'd all bleed to death. But if you have an injury inside of a tube, like a blood vessel, and that injury causes bleeding, blood vessels bleed, then that bleeding will stop. All the activities, things called platelets that are circulating in all of our blood, will clump together to form a blood clot. The problem is that when platelets clump up inside a blood vessel, it's not like on the outside where it can expand as much as possible. Inside a small tube called the coronary artery, this blood vessel stops blood flow. If the flow of blood stops in the very beginning of the blood vessel, the heart, then there's no flow down to the end of that heart. So this this is a tiny tube that now has an injury in it. And we'll talk about why you get these injuries in blood vessels in a moment. But so this blood vessel has an injury. It bleeds. Nature's way is to stop bleeding, so all these platelets come together and form a blood clot, and the blood stops beyond that. Now, if you're lucky enough to get to the hospital, only half of those with a large infarct are lucky enough to make it to the hospital. But if you're lucky enough to get to the hospital, then there are things that we can do here in the hospital to stop that. Or, if you have these symptoms and you think about it, the first thing you want to do is take an aspirin. Because in fact, the biggest benefit, the biggest bang for the buck that we can do in treating a heart attack is to take an aspirin. Why an aspirin? Because these little things that we're talking about in the blood, these platelets, they are basically inhibited by aspirin. How much aspirin? 81 milligrams a day, the baby size aspirin. We don't call them baby aspirin anymore because you don't ever want to give it to the baby, but they're in baby size. So anyway, these baby aspirins stop these platelets from clumping up, can actually stop a heart attack. So number one, call for help, and then take an aspirin. The emergency, if the EMS gets there, that's the first thing they'll do. The thermometer comes out and the aspirin goes in. But take an aspirin. If you don't have baby aspirin, it doesn't matter. Any aspirin you have, take an aspirin. So why is it that women then have more problems? Again, it's a matter of size. A woman's heart is about 2/3 the size of a man's heart, body size. It's all about body size. So if you go in to fix something, you have a big structure to work on, it's easier to work on. Women with smaller bodies and smaller hearts are simply harder to work on. Thus, they have more complications if in fact they have a heart attack. What does that mean? That means we need to do more to stop heart attacks in women. And that's what the whole focus of this conference is to stop these from in the first place. So it's not only the mechanical issues of size that put women at risk, it's how women present with their symptoms of heart attacks. Most men, again, have this Levine side, they have this crushing chest pain. Many women do not. In fact, many women will have a nagging pain. They'll have back pain. They'll have something in their shoulder. They'll feel fatigue. The key is sudden onset. If suddenly you become fatigued, if suddenly you get back pain, if suddenly something happens that seems right, if suddenly, and most importantly, you become sweaty and short of breath, those may very well be your only signs that you're having a heart attack. And those are the signs that, well, maybe you ought to take an aspirin at a time, and if the symptoms worsen or don't go away very quickly, you really do need to seek attention for this. So women will complain of other kinds of things, not the things that men will. And if they don't come to the hospital, then they'll sort of forget about it because it will go away after a while. And then when they see the doctor, they'll complain of these kind of, well, I think it's my arthritis, I'm getting a little older, I've got these other kind of problems, I don't think it's really anything. And we'll usually make light of their symptoms of heart disease, and they'll get treated with anti-arthritis type of drugs or painkillers of other form, and not have the workup for a heart that would show that they've had a heart attack. Now, the workup doesn't have to be very sophisticated. Sometimes just a simple electrocardiogram. If it's normal, that's always good. Of course, normal electrocardiogram doesn't mean you're free of heart disease, because in fact, that's just a snapshot over 6 seconds. You put the electrodes on, you take a little picture of your heart, electroactivity, and there's nothing going on at the time. It doesn't show anything. So other tests have to be done to find out if there is coronary disease. And once again, women are different from men. A stress test. I'm sure several of you have had stress tests here. The test that most doctors use to determine if there's coronary disease is a stress test. It's a graded exercise tolerance test, where you get on a treadmill and you walk and your electrocardiogram is followed. The stress test is a good test if you have good exercise tolerance. The problem with the stress test is that they're more likely to show what's going on in a man than in a woman. And in fact, women have what are called false negative tests. In fact, they do have heart disease and the test doesn't show it, or that shows that they have heart disease when in fact they don't have it. So the results that you get from a stress test aren't as good in women as they are in men. So stress tests may not be the best way, and of course there are ways to get around this business of the sensitivity and specificity, as it's called in medical terms, and that is by using some imaging techniques. And these imaging techniques, I don't want to get into the details of it, but we have some nuclear techniques that we can actually image the heart. We've got some ultrasound techniques that we can image the heart, kind of like imaging a baby and a pregnant woman. You can image the heart, see it moving, and see if there's any effects. So we have all these kind of tests that increase. These tests are painless for the most part, and they're fairly rapid to do. And these are the kind of tests that may be required. So you have the diagnosis of coronary disease, and now we're going to think about therapy. Once again, women are different. How many take an aspirin every day? And how many are taking it for your heart? Problem is that aspirin at 81 milligrams probably isn't as effective at preventing a heart attack in a woman as it is in a man. But it is effective in preventing a stroke. So, and in men, it's not quite as effective in preventing stroke as is a heart attack. Once again, big difference between men and women. You would think that in medical science and all the sophisticated state that we can do all these MRIs and 3D imaging and stuff, that we could at least understand the simple things as why a drug works better in a man and a woman. Well, this is changing now, but the way it has been is that the way medicine works is by a thing called a clinical trial. Some of you may have been in clinical trials. A clinical trial is simply, I don't want to say the word guinea pig because that's really not it, but in fact you volunteer to be a, well, guinea pig, and in which you are given a form of treatment compared to a placebo. A placebo is, it could be a sugar pill, it could be something else. Nice thing about placebos though is they work 30% of the time, so whatever ails you, take a placebo and you're probably going to get better 30% of the time. So anyway, you can take a drug and find out the effects of it. But up until about the past 5 to 6 years ago, these clinical trials were almost exclusively done in, well, men. Why men? For a variety of reasons. Because there could be hormonal reasons, there could be, the biggest reason is, well, you can't give an experimental drug to a woman who may become pregnant. That doesn't apply to an older group, but in younger women it certainly applies, since most of these clinical trials take the whole framework from adult, which is defined as anybody over 18. Oh, by the way, I don't know if I want to tell you this because you're not going to like it. The National Library of Medicine basically defines the pediatrics and child and toddlers and adults. They define adults up to 18 to 44. And anybody over 44 is considered aged. Now, that's not me. I'm just, don't shoot the messenger. I didn't make that up. But that's our federal government defining, you know, who all of us are. Well, anyway, so the clinical trials are basically in adults. And adult women in 18 to 44, there's this issue of the potential of pregnancy in which you don't want to use experimental drug. And that's why women haven't been included in a lot of these clinical trials. That will be changing. I expect in the next 5 to 10 years that all trials of all drugs will be gender specific, because of the significant differences between how men and women deal with drugs. Some drugs don't work for men, some drugs don't work for women, some, of course, don't work for either one. So those are things that are going to come in, but you need to understand the fact that these differences do exist. For the most part, please remember that when you have the symptoms that you think may be heart, it may very well be, and that if you're going to be judged by the same criteria that we judge most men for having a heart attack, it's not going to work, and that there's such special testing that needs to be done for women. Now, how about prevention? Does prevention work for men and women? Well, there's a difference with aspirin. We're not sure about other drugs. One of the most important advances in medical science has been the advent of certain drugs that have been heart attacks, statins, and I suspect there's a lot of people in this room that are taking statins. Now, you may have read the headlines in some papers that statins not required for many people. Well, there's two sides to this story. We now know about statins is that they are remarkably effective drugs. If you have heart disease, if you've been diagnosed of having a heart attack, if you have a positive stress test, if you have plaques anywhere in your body in a blood vessel, then you probably have heart disease. It's those individuals who have heart disease have the best effects from a statin type drug. And what the headlines have told us is that those that have never had any heart disease, now the guidelines for beginning these statin drugs like Lipitor, Zocor, Pravachol, these types of drugs, which I'm sure many of you are on, are probably not needed at lower levels of cholesterol. In fact, there's other things that we can do besides take a statin. And be aware that statins are, it's not a like this, a free lunch. There's a price to be paid for these statins, and some that aren't always talked about. We know that, and many of you already know that if you take a statin type drug, that you can have muscle aches and pains, and it could actually increase the amount of pain that you're having and decrease your ability to do physical activity, decrease your physical activity. So statins are not a panacea. We need to figure out who should take a statin and who shouldn't take a statin. In the next 10 to 15 years, we will be doing genetic testing to see who's vulnerable, both men and women, to find out who should be taking these statins. So until then, my best advice is follow your doctor's advice on whether you need a statin or not. But not everybody needs a statin, even though they're probably the most effective drug that we have. What about simple things that we can do ourselves? When we talk about, what about a checkup for heart disease? Well, it's a checkup that you can do right now and when you go home. Two things that you need to do for your checkup. One is stand on the scale and look at your weight. And then look at where you were a month ago and a couple months ago, and then look at the charts and find out what the ideal weight for your age, body size, and gender. And try to get as close to that ideal weight as possible. Does that mean that you have to be a runway model? Of course not. But it does mean that if you want to reduce the risk of heart disease, losing weight is very helpful. So that's the first thing we want to do when you do our checkup, is look at our plate. And the second thing we want to do is look at our exercise schedule. Because of all the activities that we can do, heart disease is one we actually can run away from. In fact, the degree of exercise is related to the amount of atherosclerosis. Does that mean that you need to go out and run races? Of course not. But it does mean that you should have at least 30 minutes of vigorous exercise a day. What do I mean by vigorous exercise? That's walking. If you walk for 30 minutes, it doesn't mean walking to the ice cream store and back to your car. It does mean getting out and maybe taking your dog. You know, dogs save lives, and one of the reasons they save lives is to keep people active. And you walk your dog out for 30 minutes and build up a sweat. So it's at 30 minutes, if not every day, almost every day. Okay, you can take your birthday and Christmas off, but other than that, no more. So diet and exercise are the things that you can do that are probably the most effective things to keep yourselves out of having to deal with folks like me would want to put tubes and stuff into your body and to try to prevent the heart attack that you could have prevented. So we've gone through the sort of the gamut of what heart disease is, how a heart attack occurs, how it's different in women. There's a lot of other things about women and about how we are developing systems to identify gender-specific drugs, procedures, and a variety of ways to prevent this very preventable problem called heart disease. And with that, I just want to stop, and we're going to have a question and answer session, so see if there's any specific questions that I can answer right now. Yeah, I'm back.
You mentioned aspirin is a good preventive or medicine. What if you're allergic to aspirin?
Yes, the question is, what if you're allergic to aspirin? There are substitutes. They're not good substitutes. There's a drug called clopidogrel, clopidogrel is a drug that is commonly given to anybody with peripheral vascular disease or coronary artery disease, and it stops blood clots when it is combined with aspirin. It's called dual antiplatelet therapy. Either drug by themselves works. Aspirin works about twice as good as the drug Plavix, or the generic name, or the brand name that you probably know it by is Plavix. So it's an effective drug. The problem is it's much more expensive and has a few more side effects. So aspirin, if you can't take aspirin, a drug like clopidogrel, which is a generic version of Plavix, is an appropriate drug to take. That's something you really have to talk to your doctor about. Yes, ma'am.
Can you take aspirin with depression medicine?
Yeah, the aspirin does have a lot of side effects and a lot of drug interactions. It depends on the specific drug. You need to ask your doctor about whoever gave you the depression medication. But for most people, 81 milligrams is well tolerated, causes no problems. The side effects from aspirin don't come with the fact that just a small dose of aspirin, but the dosing of aspirin. So if you take 81 milligrams a day, you're very unlikely to have a side effect. The most common side effect of aspirin is gastrointestinal problems, bleeding, GI bleeds mainly, gastrointestinal bleeds. And that occurs at higher doses. So if you get the biggest bang for the buck at 81 milligrams, that's probably the best dose for most people. It doesn't work for everybody. And aspirin doesn't work for everybody. But at 81 milligrams, the side effect is so small that it is not innocuous, but as close as you can get. Now, does that mean that everybody ought to start taking an aspirin? It does not. Because aspirin, like all drugs, it's a powerful drug. It has powerful side effects. And even at 81 milligrams, it can cause bleeding. It can cause stomach upset. So if you're at risk, you probably ought to be on aspirin. If you're not on risk, boy, it's really hard to make somebody that feels good and has no problem get better. So I wouldn't take it. Yes, ma'am.
What time of day should you take an aspirin, and do you take it with or without food?
Yes, the aspirin that is commonly prescribed now is called enteric coated. It has a little candy coating on it. So it really doesn't make any difference because it takes about 6 hours for it to get dissolved. So you can take it with or without food. Now your doctor may know something specific about you and advise otherwise, but you can take it any time of day. Most people take it in the morning. Some people feel better taking it in the evening. It's not important when you take it, but that you do take it if you're going to take it. Yes, ma'am.
If you're having a heart attack and you're trying to take your aspirin, you should chew it then, otherwise.
Well, the recommendations would say if you were to call EMS, they would have the aspirin tablet and have you chew it. Now, are there any clinical trials that shows it any better? No, but it's really dramatic, and to get somebody's attention because it doesn't taste that good. But so, in fact, I would do the same thing. If you're worried that you're having a heart attack and you have an aspirin tablet, chew it because particularly if it's candy coated, because it'll break the candy coating and it is absorbed a little faster. And maybe just the act of chewing makes it get in your bloodstream faster. Yeah.
Back pain, what part of the back?
Yeah, and so it's just back pain. Some people it goes to the left shoulder. Typically in men, chest pain, the typical in chest pain is a squeezing sensation that radiates to the left shoulder. In women, the radiation is the same, but it's usually not a squeezing. It's just a little uncomfort, but it still radiates mainly to the left shoulder. But it can radiate to the right, it can go down to the elbow, it can go into the jaw. Classic symptoms are crushing chest pain with radiation to the jaw or to the left shoulder or right shoulder, but left shoulder is more likely. I wouldn't count on that, though, to say that it wasn't a heart attack, it was going to your right shoulder. Yes, ma'am.
I had a problem with, after I ate a meal, my blood pressure took a dive, and the doctor told me that your blood goes to your stomach to digest your food. Why would all the blood from your heart go there?
No, not necessarily. Well, it depends. Yes, he's absolutely right that blood goes where it's needed, and if you have a big meal, then blood is diverted to other organs, usually arms, legs. I think after the brain too, because that's why you get sleepy after eating, but maybe not. Anyway, the blood does get recirculated to the stomach, because the stomach is basically grinding up that food and pushing it along. If you have a full stomach, yeah, you will have some diversion. But the heart and brain are pretty protected organs, so it usually doesn't take it away from the heart or the brain.
What would make it do that?
Make what now?
The blood pressure drop just.
After eating? There's some.
It's like about an hour and a half after I ate.
Yeah, there is a name for that, but it's usually it has nothing to do with the heart. I wouldn't talk to your doctor about that because that's more of a gastrointestinal problem. It's got kind of a funny name. Which... Yes, ma'am.
I'm just wondering, are there some statin drugs that are less apt to cause muscle aches than others?
A great question. Here, are some statins more likely to cause muscle pains than others? No. But it depends on an individual. So if you're on one statin and it's causing problems, switch to another. And something else that has been coming out now, this is not in any guidelines, but you'll find some doctors will recommend this, and that is it could be the dosing of the statin. Some folks get by with taking statins not every day, but on alternate days, or maybe every third day, or fourth day, or fifth day. So that's something you want to talk to your doctor about. But the statin that's the best for your neighbor may not be the best for you. Fortunately, we have several different statins they can choose from. So if one doesn't work, then try the other. Now I can tell you about some things that some of my patients have done, and some of you may be taking it. There is a medication, so it's not a medication, it's a food additive called coenzyme Q10. It has been touted in the past to relieve the muscle aches and pains from a statin. The federal government says it doesn't work because clinical trials have shown that it's not effective. But I have several patients who have tried it with and without, and have taken it for a while, they feel better and they stop it and they have muscle pains. They take it again and the pain goes away. So I'm going to put that out as an experience, but not as a recommendation, because the official recommendation is it doesn't help. But it may.
And what time should you take cholesterol medicine?
Yes, some cholesterol medicines are specifically given at night, particularly the ones that absorb cholesterol, because that's when your gut basically causes the cholesterol to recirculate in your system. So if you take it at night, it may be more effective. Several of them, like Zolcor or simvastatin, should definitely be given at night, and atorvastatin or Lipitor should be given at night. Some of the others probably doesn't make any much difference. Most physicians will give it in the evening, though. Yes, ma'am.
If you lower the numbers, cholesterol and triglycerides and everything is good for a whole year, but your doctor would to keep you on a cholesterol medicine, is it wise to get off of it, or should you continue it even after a year of seeing good numbers?
Yeah, that's you need to, if you're using that year wisely, to get used to a diet that has been proven for you to be effective in lowering your LDL cholesterol, that's the bad cholesterol, then you may be able to come off of it. Not everybody gets started on a statin needs to take it for life, but most people don't really change their diet very much and take a statin. In fact, is that maybe I'll take a double dose and I'll have that Big Mac today. And it doesn't work that way. So if you are trying to get your cholesterol down and you need that push, wow, I can really get my cholesterol down, but you've done diet and exercise. Exercise is most effective way of getting cholesterol down, and exercise also gets the good cholesterol, the HDL, up. So exercise gets the good stuff up and the bad stuff down. And if you're effective in getting those lifestyling changes done, it's not diet and exercise, it's lifestyling. If you can do those lifestyling measures, your cholesterol will go down, and in time, you may be able to come off that statin and save yourself some money. So yes, you should have a periodic evaluation to see if you still need it. Unfortunately, most will still need it.
We can maybe
Yep.
take one
Yep.
more question.
Okay.
There's time for more questions
Okay.
after.
Yep.
But if we can take one more now, and then we will introduce Miriam, and then we'll go back to some more Q&A.
Okay, one more question, and then you get really find out how you can prevent heart disease. Yes, ma'am.
Is there any clinical trials that have shown that one cholesterol medication works better against heart disease than the others, one that stands out?
Yeah, there are drugs that are more potent, but all of them have been shown, every statin that's approved by the FDA has been shown to, one, reduce the incidence of coronary disease, reduce LDL, and some of them have actually been in clinical trials shown to reduce plaque better than others. The trial that's in the literature that you can look at, if you look at the trial called the Prove It trial, or the reversal trials, it showed that high doses of atorvastatin remove more plaque from blood vessels than a similar dose of pravastatin. So yeah, there's those status. But the bottom line is the best drug for you is the best one that you tolerate.
Okay, the topic of my presentation is shopping list for healthy heart. So let's go shopping with a dietitian, with me. Now, in this presentation, I'm going to talk about specific nutrients, the limitations, and the daily recommendation as part of a heart healthy diet. Now, the information presented is based on a 2,000 calorie diet, which is a general diet for the population. So let's start by knowing the fats. Okay, there are 4 types of fats: the monounsaturated fats, polyunsaturated fats, saturated fats, and trans fats. The mono and the poly are the good fats, and those are mainly found in plant sources. For example, the mono is found in olive oil, almond butter, and avocados, and the poly in soybean oil, liquid margarine, and salmon. And and we had a meal with salmon, which is the good fats. Now, the saturated fats are the bad fats, okay? And some examples is butter, shortening, and processed meats. So the saturated fats are mainly found in animal sources, okay? And I included butter because it's made from milk and it comes from animal, okay? And the trans fats is another type of bad fat. And those are mainly found in processed foods like shortening, pastries, donuts, cookies, all the good stuff. Now, the idea is not to eliminate it from the diet. The key is moderation, okay? And so once in a while it's okay, all right? Not every day. Okay, now, how much fat do we need as part of a healthy diet? Now, like I said, based on a general calorie intake, which is about 2,000 calories, the amount of cholesterol that should be part of a healthy diet is less than 200 milligrams per day. Okay, and now, most of the foods in the food label, it is listed in milligrams. So it's easier to know what is how much cholesterol is in the product. And I'll talk more about my food display in a while. Now, the total fat, including healthy fats, the daily intake should be about 50 to 75 grams. So that's about 25 to 35% of your calorie intake. And the saturated fats, approximately 15 grams, which is the 7%. So saturated fats should be less because those are the bad fats. Okay, one of my favorite nutrients is fiber. Why? Because fiber has a lot of benefits. Among those benefits is that fiber is cardioprotective, because studies show that fiber helps lower cholesterol, the bad cholesterol, which is the LDL. And it also reduces the swings in blood sugar levels. In other words, it slows digestion. And another key point is that it helps you feel great. So it helps with mood as well. That's the power of fiber. Now, there are two types of fiber, soluble fiber and insoluble fiber. And I have this picture to show what it does to our body. The soluble fiber, it dissolves in water. And the soluble, how it helps, it helps lower cholesterol in the blood and the bad cholesterol, and it's found in, examples are beans, fruit, and oats. And the most popular food is oatmeal. So eat more of your oatmeal because it has the soluble fiber, which studies shows that that type of fiber lowers down the cholesterol. Now, insoluble fiber, this is the one that does not dissolve in water. So in other words, the insoluble fiber, it acts like a sponge in our body, in our intestines, removing all the bad stuff, okay? And it increases the bulk. Now, the insoluble also helps with constipation. And some examples of insoluble fiber would be broccoli, cabbage, and the dark leafy vegetables, and also in bran cereals, and brown rice, and also whole wheat pasta. So that's the difference between the two types of fiber. I am presenting the daily intake of fiber, and this is for adults, and it differs by age and gender. For example, men, I had to put men because we have, I was thinking that we were going to have some men in our presentation. And there's a few, yes. So men 50 years old and younger, so that means 18 to 50 years old, about 38 grams of fiber is the daily intake. Men 51 years and older, about 30 grams. Women 50 years old and younger, 18 to 50, approximately 25 grams. And 50 years and older, about 21 grams daily. And we can also look at the nutrition facts and check how much fiber specific foods have. All right? Okay, another good nutrient out there is the omega-3s. Omega-3s are healthy oils, and these are also beneficial for heart healthy and decreasing the bad cholesterol. Some examples that I have here where omega-3s are found is walnuts, flaxseed. Now, if you eat flaxseed, it's important that it's grinded so that you can get the benefits, okay? Or you can use flaxseed oil. And salmon, and also sardines. Other examples are tuna. It's also good in omega-3s. Now the benefits, more benefits. Like I mentioned, it may reduce the risk of heart disease. Now, if you take a supplement, the American Heart Association recommends that people with heart disease get about 1 gram of omega-3 fatty acids from a combination of EPA and DHA. And the EPA and DHA are mainly found in fish sources, like salmon. Okay, now sodium. It is important that we limit our intake. It is also part of a heart healthy diet. A low sodium diet can reduce the chances of having a heart attack and lower your blood pressure. The limitation on sodium, if you want to keep a low sodium diet, is about 2,000 milligrams per day. Now, if you have heart problems, it is important to keep it at about 2,000 milligrams, which is about 2 grams. And again, the food labels is listed as milligrams, so we have an idea of how much is in there. Now, when we read food labels, we want to look at the serving size. And when we look for sodium, in order for a product to be low in sodium, it should be 140 milligrams or less. So it's about 4% of the serving. That's considered a low sodium product. Now, my top recommendations is to limit your fat intake, reduce the sodium in your diet, choose healthy fats, increase fiber daily, and get moving. In other words, exercise. Like Dr. Mile mentioned, exercise is very important to reach optimal health. And also aiming to have a healthy weight. So the information provided is a type of intervention to prevent heart disease, and if you have a heart condition, to prevent further complications. Now, this is the end of my presentation, and I love quotes, and this is one of my favorite ones. To eat is a necessity, but to eat intelligently is an art. So it's not a diet, it's a lifestyle.